All right. Thanks everyone for joining us today as we kick off our session, Human Resources in a Pandemic. We are joined by local entrepreneurs and HR experts, Bryan Hunter, who owns 937 Payroll, and Amanda Wilson with Brightwork. So I will pass it over to you, Bryan, and let you kick it off.
Yeah, thank you, Audrey. Thanks for having us. We're happy to be here and talking to everybody about human resources in a pandemic. So my company, 937 Payroll, we offer payroll services, HR, time and attendance, and also do some benefit consulting. And we have somewhat recently, I've known Amanda for a while, but we recently kind of solidified a official partnership between our two companies where we are utilizing Brightwork for additional HR resources for our clients. So we kind of just wanted to kick things off with, I'll introduce myself and who 937 Payroll is as a company and some of the resources that we're providing through the relationship that we have with ADP, which if you're not familiar with ADP, is the largest payroll provider in the country. And then Amanda is going to really get into the nuts and bolts of managing people and HR, and she'll start off by introducing her company at that point. So I'll just take it away. So my company was founded in 2017, and I've got about 10 years of experience right now in this industry. Started off working for my father's accounting firm in Moraine, and then I worked directly for ADP, and then started 937 Payroll really as a way to combine those two experiences, both using a local accounting firm and mentality, and then also the largest payroll company in the country and their technology that they have. And today we serve about 220 businesses, and we just really focus between myself and my other 3 employees on just providing the best customer service possible. And as I mentioned earlier, we do that through full service payroll, time and attendance, and then some HR software, and then hiring and onboarding tool that we have, and partnering together with Brightworks. So these are kind of the 2 phases that we're focusing on right now with our clients. So we're trying to deliver a contactless human capital management solution during this pandemic, and really just focusing on how can you hire an employee and go from that first job posting to interview process to paying them, and then even doing reviews. So we have a software called 937 Get Hired that we're using that is kind of like ZipRecruiter meets a applicant tracking system that goes into a electronic onboarding system. So you can go from that initial job posting to reviewing your applicants to actually interviewing them and hiring them. And then when you combine that tool with our online payroll options that we have, and so employers can process payroll online and then do direct deposit and or pay cards if their employees don't have a bank account, you can really manage that relationship with your employees from hiring to payments without having to worry about interacting with them directly. Since we're all working remote right now, it's extremely important. So I would just recommend any business that doesn't already utilize technology to manage that process, that they explore some of the different options, and we're more than happy to talk about that. So I wanted to highlight just a couple of pieces that are going on right now that I think would benefit employers, put some additional money in their pockets, and ultimately, if you don't have money to pay your employees, then what good is figuring out how to manage them if you can't even pay them? So one thing that just came out today is that Ohio BWC has approved the $1.6 billion in dividends to be paid out to employers. It says on here that it's going out for the end of spring. That was the original announcement, but I just heard that check should be going out this month. So anybody who had an Ohio BWC policy during the 2018 year will get a dividend of 100% of the premiums that they paid during that policy year. that will apply to their outstanding balances first, and then any amounts that exceed your outstanding balance with Ohio VWC will be sent in the form of a refund check to you. And if you're familiar with some of the billion-dollar back programs Ohio VWC has done in the past, this is not the first time. It's at least the third that I know of. So those checks can be pretty large depending on how big your payroll is. So that should help provide some relief to employers. I also just wanted to highlight Ohio unemployment. Most of you probably already know, but the federal government approved an additional 13 weeks of Ohio unemployment and unemployment across the country. So Ohio is typically 26 weeks of unemployment or 6 months. It's now an additional 13 weeks on top of that. And during that 13-week period, it'll be the 50% that you would typically get of your wages plus an additional $600 a week. If you have any employees who are filing for unemployment, you can find this on our website, on our blog, but just make sure that your employees are filing online. It's very hard to get through on the phone. And when they do file online, that they use this mass layoff number. What this mass layoff number is going to do is allow for that unemployment claim to be charged to a mutual fund that's funded by the state of Ohio and the federal government, which means that your employer account will not be charged. Your rate won't skyrocket if the employees are doing that. Now, if your employee has already filed or forgets to do it, don't worry. They are trying to reclassify these claims as much as possible. But if we can have them do it from the beginning, that will definitely keep things much neater and keep you from having to work with Ohio unemployment to get things potentially reclassified in the future. And then don't forget to have your employees file their claims every Sunday because it's a weekly thing. So I know I've been working with a lot of clients who employees forgot to do their claims and they're calling me with questions. Hey, can we go back? And it does let you go back. But if you miss more than 1 week, it's very hard to go back and get that money. And then I just wanted to also highlight this ADP website. So 937 Payroll, we focus on providing the customer service, and then our back the house is primarily ADP. We also work with Paychex and Gusto as well. But there's this site, if you guys want to write this down, I know it's kind of convoluted, but sbshrs.adpinfo.com/COVID-19. This site is a fantastic resource, and it has these different sections in here for employers to look over. I won't go through every single piece of this because there's so much information in this. Each one of these pieces is probably a presentation by itself. But there's just a couple of things that I wanted to highlight in here. One is the Families First Coronavirus Response Act. In this section, it talks about how if your employees get sick from COVID-19 or they're taking care of somebody who's sick from COVID-19, then you're required as an employer now with less than 500 employees, this started on April 1st, so just 9 days ago, to pay out 80 hours of paid sick leave. And if they're full-time, if they're part-time, then you just pay them the average number of hours they would work over that 2-week period. If they're sick themselves. If they're taking care of somebody who's sick, then you would pay that person 2/3 of the employee's regular rate of pay. So take some time, make sure you understand that. Also, after the first 10 days of this act, the Emergency Family and Medical Leave Expansion Act takes place, which says that essentially, if you have any employees who cannot find childcare, that you have to pay them their pay up to $200 a day. There are some exceptions to this, so make sure that you understand this as well. And then the last thing I wanted to point out is this paid sick leave tax credits. So if you do pay this out for anybody who's sick, or taking care of somebody who's sick, or they cannot find childcare, then you as the employer can get a tax credit eligible for 100% of the qualified sick leave wages paid. And then that tax credit can be given back to you through a credit against your employer federal taxes. And if you have any taxes that are above and beyond what you can get through your tax credit, then you can file IRS Form 7200, which allows for you to get an expedited refund, advance payment of the employer credits due to COVID-19 back if your liabilities on those wages are greater than the amount that you can get a credit for on your tax return. I'm assuming it's going to be the 941. I haven't seen the guidance on that yet. So that's something that's important to know, and I would definitely recommend that you take some time to research that section. Another thing I wanted to point out is the CARES Act as well, and a lot here. You know, we were talking before this call started about the PPP loan. That's kind of the hot topic right now. So if you're not already taking advantage of the PPP loan, or if you want to learn more information, there's a ton of information in here. And there is a employee retention credit for employers. Businesses that were subject to closure due to COVID-19. It's important to understand this credit as it relates to the PPP loan, because it's either or. You can't both take the PPP loan and this credit. So you kind of need to evaluate the two of these to figure out which one is going to give you more money. The PPP loan is going to give you 250% of your average payroll cost. Most people are using a calculation of their 2019 calendar year, the average payroll cost per month. Other people are using different periods. One period a lot of my clients are using is the January through February period. But the credit allows for employers to get up to 50% of qualified wages between March 12th of 2020 through January 1st of 2021. And this is for businesses who are fully or partially suspending operations due to orders from government. So basically, if you're a non-essential business, then you would qualify. Or it's a business who has a significant decline in gross receipts, which is less than 50% of your gross receipts for the same calendar quarter in 2019. So again, the big thing to know about this is you need to understand what this potential tax credit is that you could get and how much money that could be in comparison to the PPP loan, I think, to make an educated decision on which one is better for you and your business. So just take some time to look through that. And then the last thing I want to mention before I pass this over to Amanda is there's a great policy section on here. In this policy section, I know Amanda's going to walk through some policies that she's created for her clients as well. But these are free resources provided for ADP that you can add to your employee handbook. And they're policies that you can roll out around the emergency paid sick leave, public health emergency leave policy. This is the one where, you don't have childcare for your employee's child, and you have to pay them for that time. And then an infectious disease control policy, which basically talks a lot about, what do we do in the workplace, conducting virtual meetings, practicing social distancing. What are some things we can do to limit exposure, and then how we are not discriminating individuals, but we reserve the right to exclude people with COVID-19 from our workplace. So these are great policies that can be downloaded. If you scroll to the bottom of the policy, it says download the policy, and then you can replace your company information, titles, start dates with your own information, and implement these in your own employee handbooks. So take some time to look at those. And that is all that I have. So at this point, I'm going to pass the control over to Amanda. Get the right thing open here.
Okay, awesome. Thanks, Bryan. So I think I have it now, right?
There you go. Yep.
Okay, awesome. Thank you, Audrey, for having me, and Bryan for including me as well. So as Bryan mentioned, we partner together. So if somebody's reaching out to Bryan and I can help, he will call me. So we have been talking more frequently recently just with what's going on in this pandemic. So this presentation we'll send out afterwards, and I offered to Bryan that if any of his clients or anybody on this call wants 30 minutes with me, I'm happy to jump on a phone call and talk specific about your company and how I can help and what guidance you may need with that. I'm certainly reaching out to all of my clients and helping them. So happy to share the policies and the email drafts that we are doing for our other clients. A little bit about me. Let's see, is this gonna work? I don't know why I'm drawing right now. I think I'm not. Is it not working?
Let me see. Make sure
I don't know why I'm drawing right now.
Oh, there we go. Try it now.
Okay, awesome. Okay, there we go. Okay, so a little bit of background about Brightwork and me. So we are a finance, HR, recruiting, and operations firm. So we will serve as your in-house COO in whatever capacity that looks like. We are generally serving employees with fewer than 100 or 75 employees because they don't need a full-time executive level in any of these categories. And so we can come fill the gaps with that owner, with that president, to help them in that space that they're not as familiar with. So today, obviously, we're going to focus on the HR piece of it. A couple of things that I can dive more deeply into if you guys have questions. And certainly if you have questions throughout this, I'd love to answer that. I know it's a smaller group today, so if there's something specific that you want to ask about, we're certainly going to provide a Q&A at the end of this. Bryan and I can both answer questions, but don't hesitate to reach out if you have something or want me to expand. We all are aware of this Ohio stay-at-home order. I'm going to dive a little bit into the FFCRA and the emergency FMLA leave and some forms associated with that, and then talk about just illness and calling in sick, some best practices there. Created some tools for an employee status tracker, and then what the school childcare closings mean for you and working from home, and then just provide any answers to questions that you guys may have. So the stay-at-home order went into effect March 23rd, and it was through April 6th. Effective April 6th, the order has been extended to May 1st. So there is a list of essential businesses and operations. If you aren't aware at this point, if you are an essential business, I'm happy to talk through that with you. Here's kind of a list of what those essential business and operations look like, and if you should be functioning or not. So regardless of if you are on this list or not, you should still be doing your part to maintain what the World Health Organization has asked us to do, and I'll dive into that here in a second. This FFCRA, so this is in effect from April 1st to December 31st. And so Bryan touched on this a little bit. There is a poster that I have here that you should have distributed to your employees. And so if you guys are not an essential business and it's not posted, or everybody's working from home, a lot of times I'm making the recommendation just to send it out through email and then post it on your premises as well. But these are the sections 1 through 6 are the different types of paid sick leave that is going to be given to you guys in addition to your PTO. So you're not going to have to take company PTO. This is going to serve as a separate bucket because the Fed's stepping in and helping the employers with this. And so as you can see, and as Bryan mentioned earlier on that website's a great resource. So you're going to figure out which employees in which category. And so they should fill out this emergency paid sick leave request form, or they should fill out this emergency family medical leave request. And then here's a tracker to help your payroll. person, figure out and have it be in conjunction with what you're putting into your payroll system so that you can keep track on your end. Who's doing what, if they're taking personal PTO, if this is the second bucket that you're going to get reimbursed from that payroll tax credit, as Bryan mentioned. So just a couple resources for you guys as you navigate through what your employees are doing and who's doing what, right? It's a lot of items to keep track of. So there is some disclaimers that should go out there with what a normal FMLA policy looks like if you have fewer than 50 employees and then even more fewer than 25 employees. You can make exceptions to some of these mandates. So something to be aware of. So employers with 25 or more employees, they are generally an employee who takes FMLA leave will be able to return to the same position or position with equivalent status, pay, benefits, and other employment terms. But the company may choose to exempt certain key employees from this requirement and not return to the same or similar position when doing so, if it would cause substantial and grievous economic injury to business operations. So key employees would be given a written notice at the time the FMLA leave is requested of their status as a key employee. And then if you are a company that has fewer than 25 employees, you should be able to return to the same position or position with equivalent status, pay, or benefits as well, just like we mentioned. But if the position the employee held before leave started no longer exists due to the economic conditions or operational changes that are made because of the public health emergency and no equivalent position is available, the employee will not and does not have to return to employment. So one thing to note, though, is for the period of 1 year after this qualifying leave under this policy ends, the company should make reasonable efforts to contact the employee if an equivalent position becomes available. So that's something to think about. There's a difference between doing what legally you can do or should do versus just what's the right thing to do. And so certainly with my clients, we're having different conversations. Everybody's doing something a little bit different, but you should do as much as you can for your employees, and that we are a community. We're doing this all together. We're all in this together. So upholding what you can for as long as you can is the right thing to do. But you should know that you don't, if you allowing everybody to take this time off and not replace them with somebody else, and it's going to destroy your business, you do have steps that you can take and procedures to do to make sure that you can keep your operations going, because ultimately that's going to help the greater good of the business, right? You can't let one person take the whole company down. You have to do what's best for the whole company. So I do want to mention that just because what's out there about this FMLA, it's the assumption that you have 50 or more employees, but there are some provisions for fewer than 50 and then fewer than 25. So that's what we talk about here a little bit. So then just diving into illness and calling in sick and kind of best practices with that. So if you are sick, you should stay home regardless of the illness. It is important to help prevent the spread of this illness by following the measures outlined by the CDC. If you or a member of your household has a presumed positive or confirmed diagnosis of the COVID-19, or you know you have been exposed to someone with this virus, you should contact HR immediately and stay home for a minimum of the 14 days. So I think something to note here, though, is in conjunction with the ADA, we should be careful about not communicating to others that somebody has this virus. What's interesting with what's going on right now is everyone is just openly talking about, oh yeah, well, this person, they had a cough, so they're staying home, and everybody's in everyone's business about what they're doing and what they heard of who went home. But it's important to remember as a company leader that you are maintaining protocol and procedures as if this was not a pandemic and it was just a normal day in the office. And how would you handle that sickness? You should maintain that. So if someone's homesick, they should follow the guidelines of let HR know what they need to do. and get HR or one person to manage this as much as possible. So there have been some of my clients that are having all of their employees reach out to their manager, and then their managers are bugging HR, but then it's just more people know about what's going on, and then they're talking about it casually. So the least amount of people that you can involved in this, the better, because it's less likely for it to get out and turn it into something that it isn't. And we need to make sure that we're protecting people's rights and what their sickness diagnosis, which is frankly nobody's business, right? So reach out to HR or the person who wears that HR hat at your company to kind of manage the funnel and the process of this. And it helps make it more consistent as well with the business. So moving on. This is kind of just like a best practice thing. So if you are staying home, right, typically you may be a company that requires a doctor's note if you're homesick. Certainly an individual that's sick should call into their doctor's office and get the recommended stay home from their doctor, right? So if it's a fever, it needs to be 72 hours. If they just have a cough and nothing else, then what does that look like? And just make sure that day to day that you are reaching out to that person who's wearing that HR hat in your business, and then go from there. The EFMLA leave form or the paid sick leave form that I showed earlier that's in this packet, those are recommended forms to use to let people fill out and return those to HR as soon as possible, just so that communication is great. And then just a big thing right now, obviously, is the school childcare closing. So if you have children whose schools or childcare facilities have been closed due to the public health emergency, staying home to care for your children, working from home, doing what you're able to from home is important. And hopefully businesses are doing what they can to allow that. So diving kind of into this working from home, a professional staff who prefers to work from home should be permitted to do so. There are certain businesses though where you're not going to be able to work from home. If you aren't comfortable coming into work at this time, allowing those individuals to use their PTO or take time off without pay, again, do what's best for your business and that person. So if you can accommodate this and you can allow some of those people to stay home, even though they're not able to work from home, let them do that. You should be consistent and have a policy in place though. So you can't, to let one person do it and then the next three that ask say no. So think ahead a little bit about, well, what does this do for the business? What's reasonable? What would I want to do if I was in this person's shoes, and accommodate accordingly. The productivity and performance expectations are obviously going to be the same if somebody's working from home versus work. So keep in mind, if you're working from home, all existing guidance and policies regarding standard work hours, reporting location of work and time, should still be in effect. And obviously working from home can be challenging. So being intentional and disciplined in your time. Just some tips below are kind of some best practices that we've given our clients, and they seem to have appreciated it. So establishing and sticking to a morning routine. So get ready for work like you normally do, right? So take a shower, make your bed, eat breakfast, walk into your workspace, maintain those consistent office hours, embrace the webcam. So I think staying connected with people is really important. So not just hearing people, but seeing people. So really dive into the Zoom or stuff that like we're doing right now. The staying connected with like the social water cooler talk is part of what connects us to each other. So maybe you do a team meeting and then afterwards you're still going to call somebody to talk about what just happened, like you would if you were in the office walking back to your work. So scheduling some of those follow-up calls or group debriefs after can really still help everybody stay connected. So this information and checklist for businesses and employers, allowing everyone, kind of again the same line, allow everyone to work from home as much as possible. Actively encourage sick people to stay home until they are free of symptoms. And And then ensure that your sick leave policies are up to date, flexible, and just pay attention to those. Keeping people with the social distance rule, I think that's really important. So are you doing what you can to feel good about if somebody got infected, that they're not going to infect others in the building? So what does that look like? Does that look like a flex schedule? Does that look like dividing shifts up so that you have less people? Are you being aware and moving people around as needed? So really just the tone starts at the top with leadership. And so the leaders need to be on board with what this looks like for the employees to feel comfortable to stay at home or speak up if they're uncomfortable. Making sure that you're doing what you can just to clean everything as frequently as possible. So in the morning before it starts, or at the end of the shift and at the end of the day, just kind of going overboard with cleaning stuff and using adding some hand sanitizer stations, doing what you can. Be prepared to change business practices if needed to maintain the critical operations. So just understand that, planning for the worst but hoping for the best is really where we should all be at right now. Here's something that we downloaded from SHRM, social distancing guidelines at work. It's something good just to pass around for what this means. And just ask everyone to read it. So hopefully at this point, everyone's taking it seriously. And so avoid in-person meetings. There's not a lot of reasons that you would need to do an in-person meeting, especially with the use of technology today. So really avoiding those at all costs. If they are going to be in-person meetings, keeping them less than 10 minutes to avoid transmitting germs and any potential sickness. Eliminate and cancel, postpone all non-essential meetings and gatherings. Don't congregate in workroom, copier rooms, or any other area where people typically socialize, keeping 6 feet apart when possible. Bringing your lunch and just eating it at your desk, or using one of the local restaurants to pick something up and just kind of isolate yourself during that lunch hour. Avoiding public transportation when possible. And then limit recreational or other leisure classes, meetings, activities where close contact with others is likely. So I think an important message is not just what people are doing at work, but what they're doing after work and on the weekend, and making sure that they understand that this is affecting everyone. So if you are choosing to not social distance yourself after work, it's going to affect what the work does, which affects everybody in the building, which affects your future pay. So just letting them understand that they are such a critical role in this, every single person is, and we're all in this together right now. So speaking of the craziness and the unknown, right, that causes a lot of stress. People are already stressed out. A world pandemic certainly doesn't help that if you have some stress issues. It's certainly going to make it worse. So here are some tips just with the World Health Organizations for coping with stress during the 2019 COVID-19 outbreak. So this may be something good to send out. I really have admired the leaders of organizations that I'm working with who are sending some personal messages to the company, at least at a minimum of a weekly basis, of just showing the vulnerability of hey, we're nervous too, right? So we're all in this together. Our business is still doing strong. Here's some things to cope. I'm here to help, or this HR person's here to help, or this person in the organization is who you should reach out to. If you have an EPA number or site through your health insurance, just doing what you can to support. I think just letting your employees know that you understand that this is stressful and hard for them on an individual level, as well as a family level and a business level, will hopefully at least help start a healthy conversation of letting people cope with it in a good way. So then I do have just some documents, posters, email drafts. If there's anyone on this call that would like to reach out to me and provide some of those draft templates, I'm happy to do that. So I know Bryan and I just said a lot. We would love to field any questions or comments or concerns that you guys have at this time.